neither approved nor available at the 2.5 twice a day Rivaroxaban dose. But let's assume that it gets approved for a patient that is on aspirin and Rivaroxaban twice a day. It was well tolerated in general in the trial. The biggest risk was major bleeding, and of that, the largest proportion was GI bleeding, and of that, it's a split between upper and lower GI bleeding. So potentially proton pump inhibitors would be useful to reduce that bleeding. Based on extrapolation from other trials, such as the Cogent trial, which showed that omeprazole reduced GI bleeding in patients on aspirin and clopidogrel, one might think that proton pump inhibitors would be useful here. But there's actually going to be an answer to that question specifically from the COMPASS trial, because there's a part of the trial still that is examining patients randomized to proton pump inhibitor versus placebo. So we'll find out from this trial whether pantoprazole specifically reduces GI bleeding in patients on aspirin or Rivaroxaban. We'll also find out whether it reduces GI bleeding in patients just in the aspirin-only part of the trial. About a third of the patients in COMPASS were on open-label PPI, so the highest risk patients in COMPASS were already on a proton pump inhibitor just based on physician discretion, but a large proportion of the other patients were randomized to pantoprazole or placebo. So I say stay tuned for that part of the trial in terms of what might be possible to reduce the bleeding risk of aspirin plus Rivaroxaban, or for that matter, aspirin alone.